everybody to the fourth, we can't believe that it's actually the fourth ESTHER Partnership Forum already. We decided this time we would put on a performance and bring us to Smock Alley. We decided that we've had enough of all of the academic institutions, and we needed a different flavour that brought us more to the community, so here we are in Smock Alley. People are going to kind of dribble in as they do in the morning, because we do have people travelling from all over the country coming in to join us today. So what we're going to do is, I'd love to start with a round of introductions, just because I think what we've learned in previous years is one of the values of this partnership forum, I think the highest value is that people get to meet each other, and people get to learn about the different partnerships and the different countries where people are working. And the real value has been able to just network and talk, and we've had lots of wonderful things that have happened out of people meeting at this meeting itself. My name is Nadine Ferris France. I'm the Executive Director of the Irish Global Health Network, and we host the ESTHER Ireland Secretariat, and also we now host the ESTHER European Secretariat, which we'll tell you a little bit about later. So let me start by just asking all of you to introduce yourself, and for those of you who are involved in partnerships, you might just say the name of your partnership or the country that you're interested either in working with or already working with. So why don't we start, Philip, can we start over here?
Philip Crowley, I'm National Director for Quality Improvement with the HSE, and we partner with Mozambique, Ethiopia, and we're exploring our partnership with Sudan on a national level.
Hi, I'm Lorraine Murphy. I'm working with Philip as part of the National Quality Improvement Team, and have been really fortunate and very privileged to be involved in the Mozambique and Ethiopia global health experience.
Good morning, I'm David Weekling. I lead the HSE Global Health Programme, and I'm involved in a lot of different countries. I'm interested in them all.
Why do we come here?
Yeah, Tom Small is my name. I'm with the RCPI, International Affairs. I'm just 1 week in the job. But just in that week I've picked up, we're doing work with Sudan, Zambia, Pakistan, amongst others.
Fabulous, welcome.
My name's Danielle. I work for the RCPI also and help run the Equals Initiative, and we work with Zambia.
Hi, my name is Cowley, and I'm from RCPI as well, and I work with Zambia.
So welcome. Luciano, our guest of honour.
Oh my God.
Taking the stage.
Thank you. I was feeling alone up here.
Oh, you feel less alone?
Yes.
Okay, wonderful. My name is Luciano Huja. I'm from Switzerland. I'm the project manager of ESTHER Switzerland. Sit for a few weeks, and my colleague is here. She will take up my job after that. So, and I'm moving on a new job. I will be the new director of the Swiss Anti-Tobacco Association. Yeah, that's it. Yeah, I'm at the University of Bern.
Thank you, Luciano. Philip.
Oh, hi, I'm Philip. I'm a communications intern at the Irish Global Health Network. Really said forum.
Still comes Joan.
My name is Joan, Communications and Events Coordinator with the Global Health Network as well.
Thanks, Joan. Jane.
I'm Jane. Probably got a lot of emails from me over the last couple of months. I've been a health partnerships intern for the last 8 months, and today is my last day.
And we are very, very sad about that.
Hello, I'm Ellen. I'm a new intern with the Irish Global Health Network as well.
Hello, I'm Hala, and I'm the coordinator for ESTHER Alliance for Global Health, and I'm from Sudan. I guess a lot of you working there.
Excellent. Yes.
Good morning, my name is Sturza, and I will be the new project manager for ESTHER Switzerland.
Excellent. Welcome. Hi.
Hi, I'm Marion Rowland. I'm from UCD, and I'm involved in our Horizon 2020 programme there with Ethiopia.
Welcome.
I am Anne Matthews. I'm the chairperson of the Irish Global Health Network for the last few years after David, and I work in DCU in the School of Nursing, Psychotherapy and Community Health, and currently working on a breastfeeding policy study in Malawi under the Coalesce project.
Thank you. Hi.
Good morning, I'm a bit of a novice here. My name is Owen Darnis. I work with a company called International, which is an
in Corina, in the camps.
Welcome.
I'm Peter Harrington. I'm a GP in Gorey, County Wexford, and together with my fellow GP Joe Gallagher, we formed the Gorey Malawi Health Partnership to try and assist Malawi in Zuzu in Northern Malawi in its management of chronic diseases or NCDs. So we're currently working really now with, we work with two institutions, mostly now with one institution, Christian institution in Northern Malawi, and trying to, I suppose, improve their management of NCDs, working primarily with non-physician healthcare workers.
Good morning, my name is Frances Farry, and I actually live in Liberia. I founded and I support an organisation in Liberia that actually helps build resilience around mental health and emotions of people who've been traumatised.
Welcome.
Hi, I'm James O'Connor. I'm an HIV advocate. My involvement with HIV is kind of extensive in a way, but specifically I worked from 1997 to 2012 here in Dublin developing a national network of people with HIV. As that increased and the focus increasingly more, I became involved at the political level and attended the UN Congress in 2006, 2008. However, while I was at UNCAS, I really wanted to understand how does policy translate into practice on the ground and in a developing setting. So the next year, in 2007, I managed to get on an immersion program in South Africa, living in the townships, working directly with people with HIV, and also visiting the subject with the civil society's response to HIV. And the reason I'm here today is because of my experience of working here in Ireland, not only with people with HIV, but all the stakeholders, civil society, HSE, the doctors, the clinics, and I must say the cooperation that we found was absolutely excellent. So I'm here today to see if maybe something can be grown out of that.
Welcome, James. Thank you.
Hi, my name is Billy Joan Rice, and I'm a lecturer from the School of Nursing in Queen's University in Belfast. And I'm here today with my colleague because we are very interested in exploring a partnership in Zambia, with a particular emphasis on the month and settlement in the summer. So thank you.
You're welcome.
Like Billy Joe, my name's Nadine McKenna. I'm a lecturer in the School of Nursing and Midwifery in Queen's University Belfast. I'm working on the same project with her. I'm also chair of the International Placements Committee within the university.
Brilliant. Welcome. And Timesha?
Hi, my name is Timesha Tracy. I'm here with my colleagues from the EPOS initiative today. I work in the Royal College of Physicians myself, and our EPOS initiative, not sure if my colleagues have spoken yet, is a joint HSE or CPI partnership that works with partners in Zambia.
Now, do you look like you're in the docks there? you're either on the jury or you're being tried. I'm not sure. How does it feel?
It feels like I'm in the docks.
Thank you. Welcome. Hi.
Hi, my name is Dermot O'Flynn. I work for the RCSI Institution, and for the last 10 years I've been very involved directly with COSEXA, where we run a training program for surgeons across 10 countries, from far south of Mozambique, which is part of Ethiopia. And my colleague with COSEXA, similar colleagues are waiting down the meeting, so they're happy here.
Thanks, Dermot. Hi.
Hi, good morning. My name is Anna Healy. I'm an ED nurse in the Mercy University Hospital in Cork. I'm also board member of Project Communities Worldwide, and who have strong links between Mayo and Kenya in Nadine Hospital. And I'm hoping we've explored where the early stages of getting a link with my own hospital, Mercy, and Mayo and Nadine districts in Kenya. Fact-finding this mission as well today. So.
Fabulous. Welcome.
Hi, my name is Katie Sheehan, and I work with Learning for Lives Ghana, which is a collaboration between UHL University Hospital in UN, and we work in the very northwest region of Ghana.
Brilliant. Welcome. And hi. How are you?
Hello, my name is Ajonko Amadiubi. I'm originally from Nigeria, medical doctor with emergency medicine.
from different backgrounds and interested in working in different countries. I hope you really get a chance to talk to each other today. We wanted to also just let you know that in the afternoon, knowing that there was going to be such an amazing group of people, we have a slot on the agenda this afternoon just for a half an hour where we'd love to hear partnership perspectives. So the invitation is for anybody who is willing and would like to share a little bit more about the partnership that you're involved in, to just come and speak for 3 minutes. 3 minutes just to share whatever it is that you would like to share about your partnership. You know, what it is, maybe some of the challenges, some of the things that you're going to do or you plan to do in 2020, or some of the connections that you're looking for. So you might just think about that as you move through the morning, and then in the afternoon we will invite whoever is willing and would like to do that just to share with us. Okay. Good. So we have a day today a little bit different to our normal partnership forum, in that in the morning we have quite a few skills building workshops, and really the reason we did that is because we've noted that in the past few years, just from all the partnerships that we're working with, that the partners are asking for skills in terms of how to raise funds. For instance, you start a partnership and that goes well, and then how do you raise funds to continue the activities? Looking at quality, how do you make sure that quality is assured in the different initiatives that you're involved in, and how can you be more aware of the do's and don'ts in terms of quality, and also just basically in terms of culture. You know, we're talking about so many different cultures and countries, and how do we be prepared for working in across culture, and how do we respect other cultures and still be able to work in a way that's efficient. So we have a couple of those skills building workshops in the morning, and then in the afternoon we're going to hear from Luciano. He's going to share some lessons about ESTHER Switzerland and just about partnerships, health partnerships a little bit more globally. And then we will have our partnership perspectives, and also we're going to focus a little bit on Cowley are going to come in and talk to us from their experience of volunteering overseas, which I think, for the most part, most of us here in a voluntary capacity. So just to learn a little bit more about that. So why don't we start? Philip, if we can invite you to kick us off. Philip Crowley, as he introduced himself there, the National Director of Quality Improvement Team with the HSE.
Thank you very much, Nadine. Wonderful to be here. I've been to maybe all the forums, certainly 3 out of 4 anyway, so 3/4 percentage attendance rate. It's a really wonderful day. I don't know what your days are all like, but today is certainly one of my positive days of the week. Not all my days are equally positive. And am I doing something there, am I?
No, something just there.
Oh, probably me. Great. In quality improvement, there's a guy called Paul Batalden, who's one of these kind of guru types in QI from the IHI, and he has a slightly annoying kind of adage that gets bunted out on a lot of quality presentations, and it is that everybody has 2 jobs. One is to do the job and the other is to improve it. We in the quality improvement team nationally, we don't use that. I work in the front line as well. I work in Merchants Quays, where my clinical practice is. And I think we're very aware that people have way more than 2 jobs. So it's kind of a patronising thing, I think, a little bit. But I think what today reminds me of is that you have your, 120 jobs that you have, and then you also create time to understand our position in a globe, in a world that is tremendously unequal, and you're doing your small or large bit to try and share skills, knowledge, and build capacity across pretty significant geographical and economic divides. So hats off to you, I have to say. The forum is obviously an opportunity for us to learn from each other and network and share. The HSE Global Health Programme, I'm very proud that it's in my team, in my division, if you like, in the HSE. I've always been very committed to global health myself, and I'm happy to say that from small seeds, we managed to get David in on a kind of a temporary loan basis. He was on loan as you have in the Premiership or whatever, and but we managed to actually sign him up finally So he's now permanently going to be, well, as permanent as anything is in the HSE. He is in position, and we're going to now try and build the office around that. We don't like it being reliant just on one person, albeit a fantastic person in David. So we'll be trying to build the office around that, and obviously a lot of our own team dip in and out to support David's work, as do I, and we support some of the overseas work as well. So I think hopefully we'll see our global health work continuing to build in the support we can give you and all of our staff to create these kind of partnerships. Institutional partnerships, I think we have some really wonderful examples in the room, and some that haven't been able to come today, but I've seen some of them out in the field, and I've certainly seen them here at these interactions. And I suppose you see, Ireland's a funny country in many ways. I mean, obviously I love it in lots of ways. It drives me mad in others. But there are certain characteristics of thinking people in Ireland sometimes, and some of the best of them is exemplified by the kind of partnership work that you do and that other people do around our health service. I spent 5 years in Nicaragua. It was a honeymoon, 5-year honeymoon. Got married and went off, and really, I would say I still draw from that all the time. In lots of ways, I learned an awful lot in Nicaragua. I went with the sending agency from London, who were very kind of locked into the concept that when you send people overseas, it's a technical skills share. You have a counterpart. You dump your skills onto that counterpart, even if they don't want them, and then you head off into the sunset, and you've created some kind of a clone of yourself, and everything's fine. It's a wonderful model in some ways, but didn't entirely impress me. I mean, I think the idea of skills share is really important, but obviously, I think, to be fair, the agency did understand that we learned an awful lot and took an awful lot back home as well. But I think the thing that they weren't so comfortable with was the concept of solidarity, and just the very act. I mean, I've noticed even in some of the visits that I've done, where I haven't felt I've really contributed a huge amount, but what I have sensed is that I've expressed some solidarity with people who are struggling with similar things to ourselves, just often in, let's be honest, completely more extreme difficulties that they face. So I think the concept of solidarity informs all of your work, and is not something to be kind of looked down on just because it's not kind of a technical concept. It's a human thing, and I think it absolutely embodies what we try and do here. I'd like to thank, just while we're here, the Irish Global Health Network. Is that the right phrase, or did somebody say the network was wrong? No, that's good. Okay, forums. Okay, network. Good. I'm on the message then. That's good. And Nadine and the team for really wonderful work in supporting the ESTHER work on our behalf, and I really appreciate that. And I just want to be part of an ESTHER alliance. And I think for me, it's interesting that Cowley will be here this afternoon. I had a lot of links with Cowley when I came back from Nicaragua, and I think what they emphasise, and I think what ESTHER emphasises, is the clear value base to the work that we do, and really being sensitive and understanding of that we go into countries potentially with a lot of power, just from the fact that we've arrived in a jet and come from a country that seems to be a more powerful country, and sometimes, not in our case, obviously, because we couldn't get our act together to colonise anybody, we were too busy being colonised, but the whole post-colonial environment is one that we need to be very sensitive to, and I think the value base that the ESTHER Alliance brings to the work that you do is really important. I think what Cowley will bring this afternoon, I'm not entirely sure what they're going to cover, but I know that they've developed very good thinking on kind of how to behave and how we need to work in a very explicit mutual respect. It's wonderful to have our colleagues from Switzerland here today as well, and thank you so much for coming. And that will be a very strong input, I think, this afternoon, so thank you very much for coming. So it's great also that the Irish Global Health Network is taking over the European Secretariat. I think that recognises the capacity that it has and the skills that it brings to its work. So I think it will make a very strong contribution to European work on that basis. All our work is in partnership. We don't all the work the College Movement team does in general is in partnership. We don't try and head off and sort things out on our own. We don't believe that's a way of achieving anything. But the global health work is very much in partnership with Irish Aid, and there are wonderful, I think, ethical, committed partners their reputation in the field is one that we're very kind of proud of, and one that we're very happy to be associated with in the HSE. And I think they provide tremendous support. They provide funding, small grants for kind of seeding partnerships, and I think it's a very intelligent way of trying to really multiply it for very small amounts of money, tremendous reach globally. So I think for a small country, Irish kind of global development work has a very strong reputation, and all of you here today are contributing to that. In terms of our own work, I've been very struck at, we go around the country improving things or trying to improve things, working in partnership with people actually improving things. We don't really improve anything, but the frontline staff, working frontline staff to improve things, and I think that can be hard because people are a little bit embattled, as they are in Mozambique and Ethiopia, where we've been doing very similar work. We've been training people up in quality improvement methods, and it's been very interesting to see how agile and quick our partners have been in taking up the learning. You go back after a couple of sessions, they're showing you driver diagrams and run charts and all kinds of things that are technical enough things to wrap your head around and improve. I was there in Mozambique when we at the end of our training program there, and a guy stood up and said his payoff line was, he said a few things about his project. He's working in a maternity unit. He's an obstetrician, and he said by way of kind of in quite a low voice, and he said, and we halved the stillbirth rate in the last 2 months, or 3 months, or however long a period of time it was, maybe 4 months. But it doesn't really matter how long it was a short period of time. And he sat down, and like if somebody said that in Ireland, I think they get whatever the Irish equivalent of knighthood is. He was completely humble about it, just thought it was part of his job. And I suppose what it shows is the potential for improvement. Obviously, when the numbers are bad, what I always say in Ireland as well is the numbers are terrible. That's great, lots of room for improvement. So similarly in other countries, but he thought this was like part of the deal. You just have the stillbirth rate. So I asked him to stand up again and say it again, because I wanted everybody to hear it very clearly. I thought it was an extraordinary achievement, and it's only one example of many amazing things that people are achieving with really fairly light input from us. And support from us and from ISCA. Actually, another partnership we have is with ISCA. The other thing also we've really drawn is the Irish Embassy Network, who've been incredible support and partners for us as well, and opened all the doors needing opening. So the other thing I guess that I've learned is the value of a strong counterpart. We have an amazing counterpart in Mozambique. I haven't been to Ethiopia, so I'm not invited, but maybe I'll make the cut at some stage. But Mozambique, amazing partner. Really strong woman, and without her, we would have achieved zip, I would say. So she drives the whole thing and deserves very much all of our respect. And I'd like to thank David for his work, and Lorraine and others in my team who supported David's work. I love the global work. I think it's really important to us. It's really good for our morale, actually, if we're being honest, and I think it's really important for our partners as well, particularly the kind of solidarity that we bring in our kit bag as well. So I'm really looking forward to the rest of today, and thank you for listening to me. Thank you.
Thanks, Philip. So David and Lorraine then, if you'd like to, and Philip actually, if you'd like to come on over, you're going to lead us. So Lorraine Murphy is also part of Philip's team, National Quality Improvement Team, and David Weekly, I think many people know as the Global Health Lead in the HSE, and also responsible from the HSE for the ESTHER Ireland programme. So you guys are going to walk us through a workshop, so get ready to move, everybody,
Yeah. We don't do any work. Absolutely no. We're going to get you to do everything this morning. Thank you. It's very well, we were having a chat about this morning and saying, well, how will we approach this? What will we do? We decided to go back to what we did only just 2 weeks ago in Ethiopia, because it worked very, very well. There's always that reverse learning element, which I'm sure you've experienced yourselves when you're working away and you just take home that learning and you take home what's good and try to apply it in context at home. So we'll have a little test this morning to see how the approaches that we used last week, how they work at home. But I have to say I'm really delighted to be here in Smock Alley. In my other life I do a little bit of drama, so I can now go and say I was on the stage in Smock Alley. So it's
It's all
There's a lot of
coming
drama at
together
work
this
as well.
morning.
Yeah,
So
uncle,
we're
it's not good.
the National Quality Improvement Team, and delighted to be here. And this morning what we're going to do is really, just within the space of 1 hour, is look at developing an understanding of what quality improvement in healthcare is. And it's also about having a bit of fun as we do that as well. Now you all know the story of Winnie the Pooh. And we just think this is the most fantastic slide because in many ways it encapsulates what we're talking about. We talk about quality improvement. Edward there, coming downstairs now, bump, bump, bump in the back of his head, behind Christopher Robin. It is, as far as he knows, the only way of coming downstairs. But sometimes he feels that there really is another way. If only he could stop bumping for one moment and think about it. And that really in many ways summarises what it's like out there and it's like at work. Sometimes you just don't have time to stop and to think, and to stop and think, how can we do this better? So this morning what we're going to do is just to give you a few nuggets. In fact, you're going to give yourselves the nuggets of things maybe to think about when you are thinking about how can we improve quality improvement in healthcare. So very recently, over the past 12 months or so, Philip, I know, has been poring over multiple definitions around quality improvement. And there are quite a lot out there, and it's very, very hard to find one that really encapsulates it all. But we think this one is quite good, and it comes again, as Philip mentioned about Paul Baltalden there earlier this morning. It's the combined and unceasing efforts of everyone. It's a very important word. Healthcare professionals, patients, families, staff, payers, planners, educated, to make the changes that lead to better health outcomes, better care experiences, and continued development and support of staff. So that's what we're using this morning to say quality improvement is. But now we're going to ask you, what do you think quality improvement in healthcare is and is not? And to do that, we're going to ask you to form groups of 6 with people you don't know. So people you don't work with essentially, and maybe people you've met on an acquaintance level previously. So we're going to ask you to all come up, to get up, and we're going to divide you into groups of 6 for about 20 minutes. So we weren't joking when we said we're going to get you moving. So we could come down and we'll all take the stage this morning. And so just meet someone that you haven't met before. To stand beside someone that you don't know or you've only met very casually. Yeah.
Anyone feel like they're going to have to do a party game?
It's not that bad, honestly. Now we're going to ask you to just start to fall into groups of 6. Just fall into groups of 6. Yeah. So in your groups, for the next 15 minutes or so, we're going to give you a sheet of paper and we're going to give you post-its. And in the group, we're going to use what's called a round robin technique. And this is really important because it gives everybody a voice in the group. So everybody in the group says, I think quality improvement is, I think quality improvement is not. And you record that on a post-it and stick it on the sheet of paper. And you just keep going around and around, and then we'll move around as well, and then we'll call everyone back together again. Are there any clarifying questions around that? Is that okay?
Quality improvement in general.
Quality improvement in healthcare is and is not. Thank you. So we've got some post-its as well. No, we might have to split it down. You know, the benches there as well. You might need to use the benches. There's a table here if you can use Did everybody get half post-its yet?
That's right.
It goes back to my mother. As a very busy niece to come out for dinner in the evening, if you watch it up, you want to press back a bit. You say do it right first time. Do it right first time, we wouldn't have to go to work. So it's all stuck with. It's always right, it's always stuck. What's that?
You can keep also what is not.
Oh, well, it's about that side now. Quick fix.
What it's not. I have very limited knowledge of healthcare, but it is not about just
Thank you.